Let's hear a word from this episode's advertiser. Queasies by Soothing Scents is an evidence-based aromatherapy intervention to manage discomfort of nausea. It's all natural and drug-free, works quickly, and is easy to administer, making Queasies an effective tool for improving patient outcomes and experience of care. Order your free sample kit at soothing-scents.com/medical today. You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, and today we are joined by ONS member Kayla Miller, member of the Pittsburgh ONS Chapter and nurse practitioner at University of Pittsburgh Medical Center, who oversees the Nurse Ambassador Program for the Wellness and Integrative Oncology Program at UPMC Hillman Cancer Center, to discuss mind-body therapies such as yoga, Tai Chi, and qigong for patients with cancers. The advertising messages in this episode are paid for by Soothing Scents. Thanks for joining me today, Kayla.
Thanks so much for having me, Stephanie. I'm so excited to be here to talk to the members about mind-body therapies for our cancer patients.
Great. To start us off, can you explain the different types of mind-body therapies?
Sure, Stephanie. There's so many different types of mind-body therapies that promote awareness of the mind and body, bring about relaxation, along with physical fitness and wellness. So today I want to focus in on talking about yoga, Tai Chi, and qigong, which all have three common components, which are breath, mindfulness, and movement. So I really want to break that down for you to get started. So first, breath, which is just intentionally noticing the natural breathing and manipulating the breath in a specific way. So an example of that could be first becoming aware of how you're breathing naturally and then deepening that a little bit so that you take an inhale for a count of 3, hold for a second, and then take an exhale for a count of 3, and repeating that for 5 to 10 times or as long as comfortable. Mindfulness is the practice that is used to intentionally bring awareness to one's thoughts without judgment. And while doing that, you might experience different stimuli or thoughts going on inside your head, but the goal is not to react or to maintain a controlled reaction to those thoughts. It's not necessarily meant to completely free your mind of any thoughts, because we all know that's just really not feasible. It's more so meant to just try to control our response to our thinking. An analogy I really like is thinking about a blue sky with clouds, and your thoughts are the clouds going by, and you just take notice of them without really getting overly involved. So that brings us into some of the specific therapies. So the first is qigong, which is a fundamental pillar of traditional Chinese medicine. It incorporates meditative movement that aligns the body and mind through cultivating one's qi, or energy flow. And in this practice, there's physical forms, which are made up of specific movements repeated in a sequence. And the movement is meant to focus on a specific purpose or problem. So, for example, to open one's airways, so that the practitioner repeats one specific movement until they feel that they've obtained that specific benefit that they're trying to achieve. The next is Tai Chi, which is a subset of qigong, and it also stems from traditional Chinese medicine. And it is a domain of martial arts, and it also combines breathing, meditation, and a series of slow, gentle, and often flowing and sort of circular movements. And it's usually done in a standing position. Sometimes you'll see people who are are sort of in like a squat or a lunge position with their knees gently bent, and they're taking really small, tiny steps in a certain direction. In contrast to qigong, tai chi involves the entire body, both in how the movements are practiced and with the goal of achieving wellness throughout the entire body. And then finally, there's yoga, which is probably the most popular or common mind body therapy that we'll talk about today. And this also, like the other therapies, combines mindfulness, breathing, and physical postures or poses that aims to relax, offer exercise, and promote a holistic well being. And sometimes movements are done in isolation by holding one pose one at a time. Other times, the movements are done in a sequence so that they flow together, and you can't really tell the difference between one pose to the next. And usually, an instructor cues students in yoga to move in rhythm with their breathing. So the breath is linked with the movement. And all of these therapies can be done in a group setting, they can be done individually, on your own. They can be done with one on one instruction, which is really helpful and a great way to personalize the experience. There's also a lot of offerings to do it virtually, to have virtual instruction. A lot of yoga studios, especially with the pandemic, have started offering classes online. You can also really easily find all of these practices on YouTube too, which is a great place to get started.
Thank you. That is such a great start for us today because I think that was a really, really detailed explanation of the different types and just ways to think about and focus on those parts of our body and things. So when we're talking about yoga and qigong, both have a really wide range of styles and practices. Like you mentioned, yoga studios and how many times we see hot yoga at different places or things like that. What do you recommend for patients first starting out?
So instead of getting really hung up on the different specific styles of practices, I think it's great to try to keep an open mind about trying different things to find what fits for you. And a lot of centers offer beginner style classes that might be shorter in duration or have a smaller class size. So I really try to suggest reaching out to a studio or a center ahead of time to ask questions about the classes, see if they have offerings that are tailored for beginners or for those who have specific medical concerns. You might learn about which specific classes are best for you. If there's an instructor that specializes in potentially oncology or has a little bit of like a physical therapy type of background who can really tailor the experience for the participants, particularly our patients. And in my experience, seasoned instructors are really attentive to physical injuries and conditions. And a lot of times, whenever you go to a yoga center or studio for the first time, the instructor will ask you if you have any medical conditions. They'll just straight out ask you. And it's a great time to just speak up so that they know if you need help in making any accommodations so that they can help you do that. As a rule, though, I would say to avoid classes that are heated or are longer than 60 minutes to get started. And specifically for people who have cancer, there's a program called Yoga for Cancer Survivors, which is a trademark standardized program that emphasizes more restorative postures along with breathing, mindfulness, and body awareness that can be really helpful for our patients. And then in regards to Tai Chi, there's a trademarked class called Tai Chi Easy, and it's a more westernized form that emphasizes safe and accessible practice.
Are those last two that you mentioned, the trademarked type of classes, are those pretty well known across the country that patients would be able to find in their area, do you think?
I believe so. I know in Pittsburgh, there's a couple of centers that offer the Yoga for Cancer Survivors class, as well as the Tai Chi Easy. So I think it's relatively accessible, in a moderately sized city, I would encourage people to sort of check it out and see if they can find one of these classes in their area.
That's good to know. So let's talk about the patients that would benefit from these practices. Are they contraindicated in any different specific oncology populations?
So, all these practices are really adaptable and can be modified to meet our patients where they are. They are conventionally done standing. However, our nurses and our yoga therapists work with patients while they're seated in a wheelchair, while they're seated in a treatment chair, or laying in a hospital bed. So, all of these things can really be customized to our patients so that they are able to access them. And, you know, who can benefit from these practices? Our goal with using integrative therapies in our oncology population is always symptom management. So I think about what kinds of symptoms are my patients having and how can I help them with these therapies. So, in terms of the mind body therapies, I think about employing them for patients who have anxiety and insomnia because it can sort of help to calm the nervous system down in those cases. And there's a specific type of yoga called a yoga nidra, and that's NIDRA, and it can really help people for falling asleep. It's specifically meant to guide people into a good, relaxing sleep. It can also help people who are struggling with depression and fatigue to get them moving to help with a little bit of an energy boost. It can be really helpful there. It can also help patients with physical complaints like muscle tension or pain. The gentle stretching involved in these therapies can be really beneficial. We see a lot of patients who were previously really active and now have been living with cancer for some time. Their energy level and their activity level has decreased, and they're not really sure how to return to exercise. And they may still have the expectation that they can only return to the exercise that they previously did because that's all they know. So, these people too can really benefit from using these therapies, and they really need our support though. They need some encouragement and some help with adjusting their expectations of themselves and just to take a first baby step to try to become a little bit more active. And they also need some instruction. So we can help teach them some of these techniques as nurses. We can also help to point them in the right direction and give them some tips in terms of getting started. Even, our patients post surgery, they can benefit from these therapies. You have to start really slow, really gentle, just beginning with breathing and mindfulness for patients who are post surgery. And then once they're 6+ weeks after surgery or they've been released by their doctor, they can start to incorporate some gentle movement in addition to that breathing and mindfulness. And there's really no published adverse events associated with these therapies. Practically speaking, I would say my biggest concern is having an injury from a fall or tripping that can occur. So, just trying to really help position your patients so that they're at a low risk for a fall. These risks can be mitigated by identifying the appropriate class for patients, being able to teach them one on one, helping them to be aware of their limitations by discussing with their nurse or their provider, and encouraging the patients to communicate with their yoga provider if they do have any limitations. One other thing that I think of, especially whenever I'm working with patients on the breathing aspect, is considering patients who may have lung disease or are post lung surgery. It's important to be sensitive of that and try to include that in your assessment of them to make sure that you're not having them do any really long or sustained breathing techniques that might make them uncomfortable.
Those are such good points. And especially, when you're talking about how patients may have been very active prior to diagnosis with cancer. And then between the therapy that they're getting and just the side effects and the fatigue that patients can experience from that, if they had never done this before, they don't understand and they might find it frustrating. And so, your point about encouraging them and really trying to show them that this is another way that they can get back to exercise and feeling like they're, engaging in something and actually being active. I think that's an important piece because so many patients feel like either they're so fatigued or they are so limited in what they're able to do. And, you've just talked about so many positive points about that and how it can be for almost all patients, even, if they can only sit in a chair. So that's really great.
Right. I mean, we see it all the time. Patients post treatment who are really struggling and want to reduce their risk of having a cancer recurrence or developing another type of cancer and want to become active again. But they were so focused on getting through their active therapy that they sort of let that go or they weren't feeling up to it. So it's a great way to try to re-engage them in some activity level that can be attainable once you're coming out of treatment.
So you mentioned when we were just talking about this, and talking about patients that would benefit from the practice, but what are some of the benefits of these activities and, the difference in Tai Chi, yoga, and Qigong? Can you kind of give some examples from your practice, what some of these benefits are?
Absolutely. So, all of the mind body therapies have pretty similar benefits, and there's a lot of overlap there. So, we really see a lot of benefits in terms of mood. So, symptoms of depression, anxiety, just stress in general that's associated with dealing with a cancer diagnosis. We also see benefits in sleep, and pain too. And the most convincing evidence for implementing yoga is for fatigue and for just general well being. I saw there was a really great study presented in the Clinical Journal of Oncology Nursing this month that found that yoga is effective at improving cancer related fatigue in patients who are undergoing treatment, and that there was an optimal benefit when patients practiced for 150 minutes per week. I mean, that sounds like a lot, but if you break it down, it's about 20 minutes a day. So it can be really doable for people. There's also an enhanced benefit whenever you incorporate mixed yoga, they called it. So including the physical postures plus the mindfulness and breath work that we talked about. And the benefit that I've experienced the most with our patients is just a feeling of well-being. And the patients report that they just feel better after they work with one of our nurses or with our yoga therapists. They just feel better. And it's really hard to quantify that in a study, but it really makes a big difference to how they get through their treatment. And they can have these tools to carry them through that they can practice on their own too. So we worked with a treatment patient who was here, day 2 of her 5-day course of therapy. And she was just feeling really like stagnant in the treatment room, just kind of like didn't have much to do, needed at least a little distraction. So we approached her and wanted to see if she wanted to do some stretching to move around a little bit, get the blood flowing. So she just sat in her treatment chair and we led her through some really gentle stretching, and she felt so much better afterwards. You could just see the light in her face after we were done working with her because she just felt like she got her energy flowing and was able to have a distraction from her sort of mundane week here in the treatment area. So, we love to see that when we're working with our patients and feel like, these therapies do help them get through their journey. In regards to meditation, there's benefits to that alone too, with helping with sleep, stress, fatigue, anxiety, depression, quality of life, all of these similar things. And, we don't always have a way to completely relieve patients' symptoms, although we have so many different methods for symptom management. Sometimes, unfortunately, the patient's symptoms just persist or aren't completely relieved. So meditation has this unique benefit of offering patients a method to cope with their symptoms. So it's that idea of taking notice of what's going on, how you're feeling, and not trying to be judgmental about it or change it, just to take notice of it. So it's not necessarily about relieving that symptom, but it's sort of just learning how to cope with it, how to live life, and keep moving forward. And we've seen benefit with meditation in terms of helping with anxiety. I can think of a patient that we worked with who was getting ready to go have a procedure done. And she was really anxious and stressed out about it. And we worked with her to try to breathe and, calm her nervous system down. And she was able to start breathing a little bit easier. And we did like a guided imagery practice for her where she imagined that she was on the beach, which was her favorite relaxing place. And she was able to get through her procedure by thinking about that. And we coached her through it. And that was really, really helpful for her. So, I think these tools can be really beneficial in a lot of different ways, and they're low risk and, potential for high reward.
I really enjoy those examples that you have been giving about patients that you guys have worked with. It's so great to hear those real life examples. And, just like you said, with not only with, the activity and feeling like you're being able to engage in activity and, things like that. But the other examples that you gave with stress and anxiety and depression, and just how, whether it's the meditation and having that imagery and going to the place that calms you, and like you mentioned, just giving the patients tools and that they can take with them wherever they are. So they might be not with you all in getting a treatment, but they might be visiting family members or something. And, something causes them to, be anxious, and just that they have that to kind of go into their toolbox and pull out and know that, they can use that breathing or that imagery to help get them through a stressful situation. So that's just so valuable, I think, for folks. And now, let's hear a word from this episode's advertiser. It's a complicated time, and patients want to feel at ease and in good hands. Developed by a nurse for nurses, Queasies is made to be uncomplicated. It doesn't require IVs, dosage requirements, or a physician's order. So it lets nurses focus on what's important, boosting efficiency while providing excellent care. Queasies has also been designed to meet hospital safety standards and can be used on all patient populations. Call Soothing Sense to learn how you can order for your facility or apply for a free sample kit at soothing-sense.com/medical. You mentioned how, there aren't a lot of clinical trials that have been done on this, but there have been some clinical trials that have shown that Tai Chi improves insomnia symptoms and sleep quality. Can you talk about this a little bit and talk about what the research that you all use to guide your practice is?
Sure. So we know so many of our oncology patients struggle with insomnia, and cancer treatments can sort of just perpetuate this problem. And while there's many treatments that exist for insomnia, most commonly medications or CBT, these aren't always appealing or accessible to all of our patients. Sometimes patients who, take sleep medications can feel groggy, or they may not be interested in seeking out therapy to help with sleep, or they may not be able to find it in their area. This is another opportunity for where we can start implementing integrative therapies to help with symptom management. And in regards to Tai Chi specifically, research in the non-cancer population found that it's beneficial at improving insomnia. And one study noted that practicing for an hour and a half to 3 hours per week for range of 6 to 24 weeks does significantly improve sleep quality. And again, an hour and a half to 3 hours kind of sounds like a lot when you think about it, but if you break it down into small chunks every day, it's really attainable for people. And I think with Tai Chi, there's a lot of emphasis on participating in a regular practice every day to obtain the greatest benefit. And that can even be for 5 to 10 minutes a day. Similarly, in the cancer population, there was evidence that found that Tai Chi improves insomnia in addition to depression, which we know is intimately related to each other. So the mechanism is not completely understood, but interestingly, Tai Chi is found to actually reduce cellular inflammatory responses and the gene expression of pro-inflammatory mediators, which are both associated with sleep disturbance. So there's really sort of a cellular impact that Tai Chi and these therapies can have to help promote symptom management. And it's really interesting to me to see how these work on this molecular level to try to help make people feel better and have a better quality of life.
That's really great to see. I hope that we will start seeing more research being done and supportive around these different types of therapy. So, I was wondering if you could describe for us UPMC's Nurse Ambassador Program and how you all just developed that. It just sounds like a really interesting and really great program.
Sure, I would love to describe it a little bit for you. It started with the development of the Wellness and Integrative Oncology program at UPMC Hillman Cancer Center. And this program was started by a medical oncologist and hematologist named Lainey Francis. And she developed this program to help patients with symptom management and well being all throughout the cancer process. So the program was developed in 2015 and is still in operation today. Dr. Francis sees oncology patients for consults and will recommend integrative therapies to them like acupuncture, massage, yoga, meditation, nutrition, exercise to try and help with their symptom management. And when she developed this program, she began with the goal not only of referring to the integrative providers that we have on staff, but also the goal of connecting more patients with integrative therapies. So, just on a more global level through our institution. And it's really difficult to get a lot of integrative providers certified to practice within the organization. So, we were able to come up with the plan to train nurses to use their nursing practice to implement integrative therapies at the bedside and the chairside for oncology patients. And, these therapies used to be taught in nursing school. If you think about it, I remember when I was in nursing school talking about doing a simple back massage or a hand massage before a patient goes to bed at night to try to promote sleep. And I think this was done even more, decades ago, but it's all really part of the nursing process. So the Nursing Ambassador Program was launched in 2016, and it started with training for oncology nurses. And the nurses are trained to offer hand and foot massage, aromatherapy, seated yoga and stretching, mindfulness, and breathing exercises to patients to, again, promote symptom management and well being. And since we started in 2016, we've now trained 115 oncology nurses throughout our large network of cancer centers in Pittsburgh, surrounding Pittsburgh, and throughout the state of Pennsylvania now. And nurses work in all different practice settings in outpatient medical, radiation oncology, as well as surgical oncology, and also in all types of inpatient oncology as well. So nurses, get to really meet patients where they are. They get to use these powerful integrative therapies hands-on with their patients to try to optimize their care.
What a great program. Can you walk us through a typical therapy session that one of the nurse ambassadors would do with a patient? And then, while you're talking about that, if you can just talk about how the nurses maintain safety in using these different practices.
Sure. So our nursing ambassadors, whenever they work with patients in this way, they structure their visit the same way as any other nursing encounter with an oncology patient, starting with an introduction of themselves and their purpose to try to help them with their symptoms by using these integrative therapies. They start by doing a good nursing assessment of that patient that would include their symptoms, any physical limitations, particularly considering if they're post surgery or if they have any trouble with breathing, like we talked about before, asking them specifically about what kinds of symptoms they're having from their cancer, from their treatments, and sort of coming up with a plan for them that incorporates some of these integrative therapies. And a lot of times we'll combine some of the therapies too. So we may use aromatherapy in addition to breathing or, massage in addition to meditation. But in terms of the mind body therapies, the practice itself begins with helping the patient find a comfortable seat. while they also have an alert posture. So, for example, if a patient's sitting in a chair, you can help support their feet with some yoga blocks or a pillow if that's available, so that they're, aligned, their hips are in line and in a comfortable position. You can also roll some blankets to support their wrists and just really make sure they're feeling supported and comfortable in their chair. And then they might continue with a breathing technique, such as just bringing awareness to the natural breathing as it's happening, and then maybe doing a counted breathing exercise, like I had mentioned before, inhaling for a count of 3 and then exhaling for a count of 3. And then from there, moving into some simple movements. So there's a routine that I really like because it's just really simple and easy to remember. And we call it the 6 movements of the spine. So the patients can place their hands on their knees and they gently arch and round their back, alternating for a few times, just really simple, combining it with their breath. And then they can reach their arm up overhead towards one side to stretch the side body and then switch to the other side. And finally, they can gently turn and rotate in their seat towards each side, again, alternating each side. So throughout the time, we maintain safety to make sure the patient's comfortable. We do that assessment at the beginning to maintain safety as well. And we just want to, be in communication with patients throughout the session to make sure that they're feeling okay and getting benefit from it. And you can usually tell by the look on their face. The look on their face says a lot, and you can ask them at the beginning to let you know if they're feeling uncomfortable, or to let you know if they're not feeling like they're enjoying it or getting something out of it, so that they can check in with you. And then at the end of at the completion of doing these movements, we want to just bring the patient back gently, becoming aware of their natural breathing again, becoming aware of their environment, and then returning to their breath and their surroundings. And through our training program, the nurses have access to a web-based app that we created that helps to guide them through some of these exercises as well. So it has photos and a script that they can use as a tool to help them while they're working with patients.
Thank you. That's a great way or a great visual for what they do, and how they actually assess the patient. And like you said, yeah, your face can tell a lot on how you're feeling and how they're doing, through many of the movements that you talked about. So, I mean, as we all know, over this past year, things have been so stressful for everyone, including the staff. And so, as we're talking about how these different mind body therapies can really help patients, have you noticed that the staff is benefiting from this as well? Or have you had staff who have come to you all to try and maybe implement some of these practices on the units with the staff and things like that?
Absolutely. We see the same benefits that our oncology patients experience. The staff can experience those benefits too from using these therapies, and can help to reduce stress, improve fatigue, and help with our mood and our quality of life too. It's hard being an oncology nurse sometimes, and especially during this pandemic when there's a lot being asked of us. So we've worked with staff here to sort of have sessions where they can kind of like get a little bit of, they have some time to talk about, their stressors or their anxiety. And we tie it all together with a meditation and some breathing exercises that's actually led by Dr. Francis, who is the director of our program. And people have really found it to be beneficial. We've been able to keep the groups small and be distanced, and people have really found support with that. And our nurse ambassadors often tell me that just by working with patients, by guiding someone through a meditation or through a seated yoga practice, they also feel the benefits at that time too, because it forces them to slow down, take a minute, really engage with the patient one-on-one, and have this sort of extra time to spend just focused on caring for this one patient and doing this one thing. They also notice the benefits crossing over to helping themselves too.
I'm sure it is extremely helpful. We have heard from, other nurses across the country when we've talked to them about, using aromatherapy and different things like that, just how many of the staff are taking advantage of that as well and really kind of utilizing it not only with their patients, but, during these times of higher stress and uncertainty and things that they're incorporating it into their own daily practice as well. So one of the things that I think we've seen a lot is, self-care is rooted in mindfulness and it's gaining popularity in the Western world. You've talked about how, a lot of the practices have come, or were Chinese practices. But what do you think is propelling this different mindset or cultural shift that we're seeing in the Western world with this?
This is something I've thought about a lot, Stephanie, and I think we have a long way to go in terms of mental health, but I feel like in the past several years, there's at least been a greater awareness of mental health concerns, and that, a lot of people struggle with clinical mental health issues, and we're recognizing that and being more aware of it. And a lot of people also struggle with like subclinical symptoms of anxiety and depression. And the reality is many people might not feel comfortable talking about their feelings with their providers, and they may not want to take a pill, or they may not want to take the next steps in terms of treating these issues, or they might identify with feelings that they don't feel meet the criteria, the DSM criteria for anxiety or depression. And people are experiencing things like sadness or fear or overwhelm or stress or loneliness. And then enters mindfulness as a way to self-manage as the first step. And along with that are a multitude of countless apps that are available, that are accessible, and they offer methods to teach people how to practice mindfulness and to keep you accountable for creating a routine. Apps like Headspace, like Calm, Insight Timer, these are some of the more popular ones, but there's so many different apps available, and a lot of them really get in there and try to help teach people how to meditate, how to practice mindfulness, and do it, throughout their daily lives. So I think it's a combination of having a greater awareness of mental health concerns and daily life struggles, and also just the greater availability for tools to try and self-manage that. I mean, that being said, I really encourage people who are experiencing sadness or anxiety to talk to someone about it. And for us as nurses to really try to ask our patients if they're experiencing these feelings, and to ask them in a way that sort of normalizes their experience and let them know that they're really not alone, and that we're there to help support them. And we have some different kinds of tools to help them cope with it.
That's really good. I think that, as you were talking about just the mental health concerns and the anxiety and depression and the word you used, using subclinical and not people not feeling like they have what would be, a true clinical diagnosis. But I think the reality with that is that folks also don't realize how much those kinds of symptoms impact their physical health and how they feel also. So by having some of these tools like you've talked about, or, guiding people to those apps that they can use every day or on their own, but even more so just encouraging patients and nurses both to have that open conversation. And then once that happens, I think, patients will recognize how doing these things will actually make their physical health feel better too, and how, it is that just awareness of our whole self. And I think you've done such a great job today at going over such a variety of what we're talking about and the benefits and things like that for the patients and for nurses. So I just have about 3 questions that I like to end our podcast with that I'd like to ask you. And the first one is, what's something about mind body therapies that is not often discussed, but you wish people knew more about?
I wish people knew that anyone can practice And you can practice anywhere you are. So in your car, in your office, at your computer, with your patient, at home with your child. These therapies just simply begin with noticing your environment on the inside and the outside, noticing your breathing, and then maybe adding in some movement, even in the smallest way possible. These therapies can be done by anyone and can be done in any environment.
Great. Next one is, what are some common misconceptions about yoga, Tai Chi, and Qigong?
Particularly about yoga, as it's become much more popular over the past 20 years. And in some settings where people practice in a 100-degree room, wear designer athletic clothing, I think that this has sort of like given yoga a bad reputation for fitting in this certain tiny mold. And this is definitely not the only way to practice yoga, and it's certainly not a traditional way to practice yoga. It's just one specific type of really athletic yoga. So, a lot of people, when we try to mention it to them, will be like, oh, yoga, like I can't do that. Like I can't do a headstand or, fit into these designer clothing that people wear to go to practice yoga. And it's just really trying to help reframe that and just teaching people, like I talked about, that anyone can practice it. You can break it down in any way and have benefits of it. So we do that a lot and try to approach people, maybe even not calling it yoga and just approaching people and saying, would you like to try to do some relaxation exercises with me today? So trying to just reframe, re-educate patients how this can be beneficial to them so that they don't have this really specific expectation in mind and just close themselves off from the beginning.
Great. And last, what are some resources for patients and oncology nurses looking for more information on mind body therapies?
So our team has created a meditation website that's relatable for people who are affected by cancer. So patients, caregivers, staff can find it relatable. And the website is called thisiskara, KARA.com. There's 12 different guided meditations on there. It's a great place to start. I like to recommend trying the one for sleep first to get started because it's just really easy to listen to as you're trying to fall asleep at night. So that's a great resource. In terms of complementary and integrative health as a whole, the NIH has a website, the National Center for Complementary and Integrative Health, which has so many good resources on it, for us as nurses, as humans, and also for our patients. And then for nurses, the American Holistic Nurses Association and their Journal of Holistic Nursing is great. Obviously the Oncology Nurse Society is fantastic, and you guys are always putting out really good information out there about integrative therapies, both in the podcast, episodes on massage and acupuncture and aromatherapy are all awesome. And there's always studies coming out in the journal too about integrative therapies that I find really, really useful for my practice. And then finally, there's more information about our program for anyone who might be local, in Pittsburgh or even not local and interested in the Nursing Ambassador program. Our website is hillman.upmc.com/integrative oncology.
Thank you. Those are all great resources that will be so helpful for our listeners today. So, do you have any final comments for us today?
I just ask that listeners would give this a try for yourself and see how it feels. So just start by noticing your natural breathing and doing a little bit of a breathing exercise, just trying to bring your attention to what's going on in your internal environment. Notice the thoughts without attaching to them or trying to change them. And just rest, take notice, and breathe and see how you feel after, how easy it is. And just tell one patient about it. And I think that you will feel a benefit, and so will they.
Well, thank you so much for joining us today. This was very, very informative, and I think it's something that, our listeners will want to take away for their patients and also for themselves. We really appreciate you joining us.
Thanks so much for having me, Stephanie.
Patients love Queasies because it's fast, has no side effects, and is easy to self-administer when needed. Oncology nurses love that Queasies can improve experiences with saline flushes and CINV, resulting in happier, more comfortable patients. Visit soothing-sense.com/medical to learn more. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.